Hyperthyroidism and hypothyroidism. Let's break this down clearly. In hyperthyroidism, thyroid-stimulating hormone is low, while triiodothyronine and thyroxine are high. In hypothyroidism, it's the opposite. Thyroid-stimulating hormone is high, and thyroid hormones are low. Now, think about the skin. In hyperthyroidism, the skin is warm, moist, and thin. You may also see pretibial myxedema and vasodilation. In hypothyroidism, the skin becomes dry, cool, and thickened. Non-pitting edema can appear due to glycosaminoglycan deposition. Cardiovascular system. Hyperthyroidism speeds everything up. Tachycardia, palpitations, hypertension, atrial fibrillation. Hypothyroidism slows everything down. Bradycardia and decreased cardiac output. Neuropsychiatric symptoms. Hyperthyroidism causes restlessness, anxiety, tremors, insomnia, and hyperreflexia. Hypothyroidism leads to depression, fatigue, lethargy, and hyporeflexia. Gastrointestinal system. Hyperthyroidism increases metabolism. So you see diarrhea, increased appetite, and weight loss. Hypothyroidism slows metabolism. Constipation, weight gain, and decreased appetite. Reproductive system. Hyperthyroidism may cause infertility, amenorrhea, or irregular cycles. Hypothyroidism may cause heavy menstrual bleeding and infertility. Musculoskeletal system. Hyperthyroidism causes proximal muscle weakness and increased bone breakdown. Hypothyroidism may cause carpal tunnel syndrome and muscle stiffness. Key concept. In hypothyroidism, everything is slow and everything feels cold. Now let's move into causes. Hyperthyroidism is commonly caused by Graves' disease, toxic multinodular goiter, and the Jode-Basedow phenomenon. Hypothyroidism is commonly caused by Hashimoto thyroiditis, congenital hypothyroidism, subacute thyroiditis, and renal thyroiditis. Graves' disease. This is an autoimmune condition. Antibodies stimulate thyroid receptors, causing excessive hormone production. It is associated with specific immune markers and thyroid-related antibodies. It is the most common cause of hyperthyroidism, especially in women of reproductive age, often triggered by stress. Now, the mechanism of exophthalmos. Immune activation stimulates fibroblasts behind the eye. This leads to inflammation, fat accumulation, and glycosaminoglycan deposition. The result is expansion of orbital tissue and eye protrusion. Pretibial myxedema. This is caused by glycosaminoglycan deposition in the lower legs. These tissues respond to thyroid-stimulating antibodies. Classic triad of Graves' disease. Exophthalmos, pretibial myxedema, and diffuse goiter. Toxic multinodular goiter. This develops due to chronic stimulation of the thyroid gland. You get multiple nodules that produce thyroid hormone independently. Patients present with a painless enlarged thyroid, with palpable nodules. Mechanism. Reduced thyroid hormone initially leads to increased stimulation from the brain. Over time, this causes nodular growth and autonomous hormone production. Finally, the Jode-Basedow phenomenon. In normal individuals, iodine intake is regulated by feedback mechanisms. But in patients with autonomous nodules, this control is lost. So when iodine is introduced, hormone production increases uncontrollably.